Welcome to Expert Living, your trusted source for evidence-based advice on how to lead a healthier, happier life. Today, we're exploring the harmful effects of smoking on heart health, and most importantly, how you can take back control of your life by quitting smoking for good. Whether you're a smoker trying to quit, or someone concerned about a loved one's health, we've got you covered. Stick with us, and let's learn how we can all protect our hearts from the dangers of smoking. Introduction to smoking and heart health. Smoking is often associated with lung diseases such as cancer and chronic obstructive pulmonary disease, COPD, but its impact on heart health is equally severe. According to the World Health Organization, more than 8 million people die every year due to tobacco use, and nearly 1.2 million of these deaths are caused by secondhand smoke exposure. Among these, cardiovascular diseases account for nearly 50% of all smoking-related deaths. It's important to understand that smoking doesn't just affect the smoker, it harms those around them too. Secondhand smoke exposure is a major health risk that can also lead to heart disease in non-smokers, especially children and family members who are consistently around smokers. But how exactly does smoking affect the heart? What are the mechanisms that lead to such devastating consequences? And most importantly, what steps can you take to quit smoking and restore your heart health? These are the questions we'll answer in this in-depth video. Understanding the effects of smoking on heart health. Smoking's impact on the heart begins almost immediately after the first puff of a cigarette. Cigarette smoke contains more than 7,000 chemicals, including nicotine, carbon monoxide, and tar, many of which are toxic and directly harm the cardiovascular system. Carbon monoxide poisoning. One of the most dangerous chemicals in cigarette smoke is carbon monoxide. When you smoke, carbon monoxide enters your bloodstream and binds to hemoglobin, the molecule responsible for carrying oxygen in your blood. This reduces the amount of oxygen your organs and tissues receive, forcing your heart to work harder to compensate. The result is increased strain on the heart, which leads to higher blood pressure and elevated heart rates, both major risk factors for heart disease. Nicotine and blood vessel constriction. Nicotine is the addictive substance in tobacco, and it has several harmful effects on the cardiovascular system. Nicotine causes blood vessels to constrict, limiting blood flow and oxygen supply to the heart and other vital organs. This vasoconstriction is responsible for the increased blood pressure seen in smokers, as the heart has to pump harder to circulate blood through the narrowed arteries. Over time, this extra strain can damage the heart muscle, leading to heart failure. Plaque buildup, atherosclerosis. Over time, smoking contributes to the buildup of fatty deposits, known as plaque, in the arteries. This process, called atherosclerosis, leads to the hardening and narrowing of arteries. Narrowed arteries are more likely to become completely blocked, cutting off blood flow to the heart or brain. When this happens, it can result in a heart attack or stroke. Smokers are at much greater risk of developing atherosclerosis, which can also cause peripheral artery disease, PAD, where blood flow to the limbs is restricted. Smoking's role in increasing the risk of heart disease. Smoking is a major risk factor for the development of coronary artery disease, CAD, one of the most common forms of heart disease. Coronary artery disease occurs when the coronary arteries, which supply blood to the heart muscle, become damaged or diseased due to plaque buildup. Studies have shown that smokers are 2 to 4 times more likely to develop CAD compared to non-smokers. Even individuals who smoke as few as 1 or 2 cigarettes a day are still at a significantly higher risk of CAD than non-smokers. The risk increases with the number of cigarettes smoked per day and the length of time someone has been smoking. One of the most concerning aspects of smoking is that it accelerates the progression of heart disease. Even younger smokers who have no other cardiovascular risk factors are at an increased risk of developing heart disease. This is because smoking causes direct damage to the endothelial cells that line the blood vessels, reducing their ability to function properly. The connection between smoking and stroke. In addition to coronary artery disease, smoking is a major contributor to the risk of stroke. Stroke occurs when blood flow to the brain is interrupted, either by a blockage, ischemic stroke, or by a rupture of a blood vessel, hemorrhagic stroke. Smoking increases the risk of both types of stroke. When you smoke, the toxic chemicals in tobacco damage the blood vessels in your brain, increasing the likelihood of a blockage. This is particularly dangerous because the brain is highly sensitive to changes in oxygen and blood flow. Even a brief interruption can cause brain cells to die, leading to permanent disability or death. Additionally, smoking increases the risk of blood clots, which can travel to the brain and block an artery, causing an ischemic stroke. Smokers are also at higher risk for intracranial hemorrhages, where weakened blood vessels in the brain rupture. Even secondhand smoke has been linked to an increased risk of stroke, meaning non-smokers exposed to cigarette smoke are also in danger. This makes quitting smoking not just a personal health decision but a public health necessity. Impact on blood pressure and cholesterol levels. Smokers often suffer from high blood pressure and elevated cholesterol levels, two major risk factors for heart disease. When you smoke, the nicotine in cigarettes causes an immediate increase in heart rate and blood pressure by stimulating the release of adrenaline. This puts additional stress on your heart, making it work harder than normal. Over time, this constant strain can lead to chronic hypertension, a condition in which the blood pressure remains elevated even when at rest. High blood pressure weakens the blood vessels, making them more susceptible to plaque buildup and narrowing. This not only increases the risk of heart attacks and strokes but also contributes to heart failure, where the heart becomes too weak to pump blood efficiently. Smoking also raises levels of low-density lipoprotein, LDL, cholesterol, commonly known as bad cholesterol. LDL cholesterol is a major contributor to the formation of plaque in the arteries, and when combined with smoking, the process of atherosclerosis is accelerated. On the other hand, smoking decreases levels of high-density lipoprotein, HDL, cholesterol, or good cholesterol, which helps remove LDL cholesterol from the arteries. The combination of high blood pressure and unhealthy cholesterol levels is often referred to as a double hit to the cardiovascular system. It dramatically increases the risk of heart attacks, strokes, and other cardiovascular events. How smoking leads to chronic inflammation and blood clots. Inflammation plays a central role in the development of heart disease, and smoking is a powerful trigger for chronic inflammation. Every time you inhale cigarette smoke, the chemicals in tobacco irritate the lining of your arteries, triggering an inflammatory response. Inflammation causes white blood cells to rush to the damaged areas, where they try to repair the injury. Unfortunately, this also encourages the buildup of plaque, as cholesterol and other fatty substances accumulate at the site of inflammation. In addition to promoting plaque buildup, inflammation increases the likelihood of blood clots. Blood clots are one of the most dangerous complications of smoking because they can block the flow of blood to the heart, brain, or lungs. Clots that form in the coronary arteries can cause a heart attack, while clots that travel to the brain can result in a stroke. Even after the initial damage has been done, the chemicals in cigarette smoke continue to promote clot formation by making the blood stickier. Smokers are more prone to abnormal blood clotting, which is why they are at a higher risk for deep vein thrombosis, DVT, and pulmonary embolism, both of which can be fatal if not treated promptly. Immediate and long-term benefits of quitting smoking. The benefits of quitting smoking begin almost immediately after your last cigarette. Your body is remarkably resilient and starts to repair the damage caused by smoking within minutes. 1. After 20 minutes, your heart rate and blood pressure drop to healthier levels. 2. After 12 hours, the level of carbon monoxide in your blood returns to normal, allowing more oxygen to reach your organs. 3. After 2-3 weeks, your circulation improves, and your lung function increases. 3. You may notice it's easier to exercise and breathe deeply. 4. After 1 year, your risk of coronary heart disease is cut in half compared to a smoker's risk. 5. After 5 years, your risk of stroke is reduced to that of a non-smoker. 6. After 10-15 years, your risk of coronary heart disease is equivalent to someone who has never smoked, and your risk of lung cancer is greatly reduced. Quitting smoking is one of the most powerful steps you can take to protect your heart health. Even if you've been smoking for many years, your body will begin to heal the moment you stop, and the long-term benefits will continue to improve your health over time. Effective methods to quit smoking. Quitting smoking is challenging due to nicotine addiction, but with the right strategies, it is entirely possible. Many people try several times before they quit for good, so it's important to stay committed and seek out the support that works best for you. Here are some of the most effective, evidence-based methods for quitting smoking. Nicotine replacement therapy, NRT products, such as nicotine patches, gum, and lozenges, provide a small, controlled dose of nicotine without the harmful chemicals found in cigarettes. NRT can help reduce withdrawal symptoms, making it easier to quit smoking gradually. Prescription medications. Varenicline, Chantix, and bupropion, Zyban, are medications that can help reduce nicotine cravings and withdrawal symptoms. These medications have been shown to increase the chances of quitting by blocking the effects of nicotine on the brain's reward system. Behavioral counseling and support groups. Combining nicotine replacement or medication with behavioral counseling is one of the most effective ways to quit smoking. Counseling helps you identify triggers and develop strategies to cope with cravings. Quit smoking apps. Mobile apps and digital tools can be excellent resources for people who are trying to quit. These apps offer daily reminders, progress tracking, and motivational messages to keep you on track. Cold turkey. While this is often the hardest method, some smokers quit cold turkey without any aids. This requires strong willpower and a clear plan for managing cravings and withdrawal symptoms. How to overcome withdrawal symptoms and stay smoke-free. Nicotine withdrawal can be one of the most difficult parts of quitting smoking. Common withdrawal symptoms include irritability, anxiety, trouble concentrating, and intense cravings. These symptoms typically peak within the first few days and gradually diminish over time. It's important to have a plan for managing withdrawal symptoms. Some tips include: stay active. Physical activity can help reduce cravings and distract you from withdrawal symptoms. Avoid triggers. Identify situations that make you want to smoke, such as drinking alcohol or socializing with other smokers, and find ways to avoid or manage them. Practice stress reduction techniques. Stress is a common trigger for smoking, so it's helpful to have healthy ways to cope with stress. Techniques such as deep breathing, meditation, and yoga can be effective tools for staying calm. Remember, every day you stay smoke-free, you're investing in your future health. The longer you stay away from cigarettes, the easier it becomes, and the benefits to your heart and overall health are immeasurable. Conclusion. A smoke-free future for a healthy heart. In conclusion, smoking is one of the most dangerous habits for your heart, but it's never too late to quit and start reversing the damage. Whether you've been smoking for a few years or several decades, quitting smoking is the best thing you can do for your cardiovascular health. By quitting smoking, you can lower your risk of heart disease, stroke, and other serious health conditions, while improving your quality of life and longevity. The journey may not be easy, but with the right support and resources, you can succeed. Thank you for watching this in-depth episode of Expert Living. We hope you found this video helpful and informative. If you or someone you know is trying to quit smoking, remember that it's never too late to take that first step toward a healthier, smoke-free life. Make sure to like, share, and subscribe to Expert Living for more expert advice on living your best life. Stay healthy, stay strong, and stay committed to your heart's health.